I got to Traverse City via a broken leg. I was doing my plastic surgery fellowship at Beaumont Hospital in Royal Oak when I had a tibial plateau fracture in my knee. And the orthopedic surgeon said, "What are you doing next year?" And I said, "I'm not quite sure yet." And he said, "Well, you know, have you ever been to Traverse City?" And I said, "Nope, never in my adult life." And he said, "Well, one of my previous residents is up there and says they need a plastic surgeon."
I think your experience begins at the Center for Plastic Surgery when you make the first phone call. You typically talk to Tina on the phone. She's excited to have you into the practice. And from that moment on, we're welcoming you to our group, our family.
Once you're here at the office, you're going to be seeing a nurse who's going to get some medical information, and then you're going to spend a lot of time with the physician. It's not an office that's going to just spend a brief period of time with the physician and have somebody else explain it to you. It's us. We're going to spend lots of time with you. Typically an hour for complex things, maybe even more.
From there, we typically have you back to the office again before another surgery. And that's one of my favorite visits because it's allowed you the time to go do additional research, come up with new questions. We go through some procedural things too and paperwork, but the point is you get to ask more questions, bring more family members, so that the day of surgery, you get to be just really excited and we get rid of all the nerves. I think you have to be comfortable with more than just your plastic surgeon. I think you have to be really comfortable with the office. You have to pay attention to the office staff. And I think that when people come here, they're thrilled with those aspects of their care. Board certification by the American Society of Plastic Surgeons is critical because it doesn't only mean that we've done lots of training and passed exams. It means that we maintain that training and keep up to date with the latest in technology and techniques, and we're held to a high standard.
Is my surgeon board certified? What is he board certified, he or she board certified in? For example, there's a board of facial plastic surgery. It's not a tested board certification. I think that it's important to pick a board certified plastic surgeon to do your facial aesthetic surgery. Make sure they're board certified. Make sure that they don't have a bunch of litigation against them. You can get online and look this up. And I think that's also that you should go ahead and check us out thoroughly. Meet us, make sure that we're reasonable, make sure that we don't zip in the room, say, yeah, you're a good candidate, and have one of our assistants tell you all about the surgery. We should spend the time to talk to you about what we're going to do, what the expectations are, what the realistic expectations are, and what the recovery times are. Well, there's a lot of skin and laser procedures out there, and so what happens is everybody who has a new laser or a new machine or a new technique is going to go out there and put an ad in Cosmo magazine and say theirs is the best that there is. Obviously, if one thing was perfect, we would all do it, but it's not. So what you need is you need somebody to sit down with you and say, for your skin type, for your skin problem, this is the correct approach.
Particularly when it comes to facial aesthetics, there's a spectrum and a way to treat different things based on laser, non-invasives, all the way up to invasive surgery. And we're going to offer you something along that spectrum which is perfectly suited to you. People trust the Center for Plastic Surgery. Steve's been here for over 15 years, embedding himself in the community, taking care of all kinds of patients, offering the best treatment and delivering on it. And I'd like to think that I've added something to that over the last 3 years. And I think that, again, this is the place that you can trust.
If this were my family member, how would I want them treated? What would I want them to experience? You should be able to get out of here and say, I think he's a nice guy, and he treated me just like he would treat his brother, his mom, his dad, his sister, his wife.